Welcome. My name is Robert Tasker, and I'm your Editor-in-Chief of Pediatric Critical Care Medicine. The August issue is another great read. If you're short of time, there are 3 articles that I would like to draw your attention to for general education. The first is by Fendora and colleagues from a cardiac intensive care unit. The authors looked at 2 years of admissions, 1,500 patients, 16,500 imaging studies, and 75,000 laboratory studies. And they explored the relationship between bed occupancy, workload, staffing, and outcomes. In our editorial, the editorialist puts forward a case for advanced practice provider teams. The second article is from Sifra and colleagues, who have carried out a systematic review of 17 papers that cover the topic of diagnostic error in the pediatric intensive care unit. Our editorialist then places this information in the context of cognitive psychology, clinical heuristic thinking, and modern technology. The third article comes from London and is by Lil and colleagues, and these authors describe a solution to veno-venous ECMO cannulation in 11 infants under 10 kilos in weight. They were all cannulated for respiratory support, and what they describe is access via the jugular vein and return via the femoral vein. And again, there is an accompanying editorial. Lastly, I'd just like to point out that there's a special section called PCCM Connections, which only you as readers and subscribers will be able to get access to, because it links articles that are in the current issue with previous articles that have been published in 2021. So, for example, in the August issue, there's a paper by Ranjit and colleagues who look at variation in hemodynamic response to 10 mils per kilo fluid bolus given over 30 minutes in 42 pediatric septic shock patients. The connections are January issue. There was an article about hypotensive CICU patients and their response to fluid boluses. And there was an April 2021 article that looked at hemodynamically unstable ventilated neonates and their response to fluids. If you pick up Twitter, I will follow the connections theme mid-month. So thank you very much for subscribing, for reading, and I value your support. Enjoy the read.